Dear students, today we are going to discuss obsessive compulsive disorder. This obsessive compulsive disorder is abbreviated as OCD. Okay, so as the name itself suggests that it is the combination of two words, that is obsession and compulsion. So let's have a look to what this obsession is separately and what this compulsion is. Okay, so first we will go to the obsessions. What are these obsessions? These are actually repeated thoughts. These are actually repeated thoughts that are unwanted and they produce anxiety. Okay, these are actually repeated thoughts that come to our mind unwantedly and produce anxiety in us. So, this is the obsession. And how can we understand this by an example? Like, we can take an example of that somebody has doubt of that he has not locked the door. Okay, he has not locked the door. When a person feels that he has not locked the door before leaving, it continuously disturbs his mind. His mind and does not allow him to engage in any other activity. Okay, this thought does not allow him to do his work or engage into any activity. Okay, now the other example is that my hands are contaminated with dirt or germs. Okay, the person thinks that his hands are not clean enough, they are dirty. Okay, they have germs. Okay, so the thought repeatedly comes into his mind that I am contaminated and I have to go to wash the hands. Okay, so this thought might come repeatedly into his mind until and unless this thought comes and continuously uh, drives him towards the compulsions. Okay, now this compulsion is, thus we can say compulsion is caused due to the obsessions. When a person has obsessions, so he is likely to have the compulsions as well. Okay, when a person has obsessions like my hands are contaminated with dirt, it this thought continuously disturbs his mind, and then he this drives him towards the compulsions. Now, what are the compulsions actually? Compulsions like this was the repeated thought, and compulsions is actually repeated behavior. It is actually repeated behavior that may be purposeless. Like this was unwanted, that behavior would also be unwanted, and this will help him to relieve the anxiety. This compulsion will help the patient to relieve anxiety. Okay, this compulsion is in response to this obsession. This compulsion is in response to this obsession. Okay, so thus we can say this obsession is repeated thought that is unwanted and produce anxiety, and compulsion is repeated behavior that relieves anxiety, and that is in response to this obsession. Okay, so I said that it reduces the anxiety. It reduces the anxiety, but this anxiety is not completely or permanently reduced, but it reduces for a certain period of time. Okay, this is not completely reduced, this anxiety. Whenever he goes and washes his hands, the anxiety gets relieved for some time. Then again the thought comes into his mind, and he goes and washes the hands, the anxiety gets reduced. Okay, like we took the example here that the door might be locked or not. Okay, this thought comes repeatedly into his mind, And now, how can we compare the compulsions with it? How can we introduce compulsions in it? How is it becomes a compulsion? When a person goes in response to that door is not locked, when he thinks continuously and goes physically and checks repeatedly that door is locked or not. So this becomes the compulsion when he physically goes and checks the door repeatedly that it is locked one times, two times, three times, four times, five times, and it can extend up to 20 times as well. So this becomes the compulsion. Now, like the other example that my hands are contaminated, the thought came into his mind that my hands are contaminated, that he feels a need for washing the hands. He doesn't go and wash the hands, but he feels need for it. Okay. Now, in the compulsions, when he goes and washes the hands more than thrice, this becomes the compulsion. Okay, so this obsession and compulsion can waste a lot of time of that person. Okay, this can obviously waste the time of a patient. Okay, thus we can compile this, we can say that obsessive compulsive disorder is an anxiety disorder. It is an anxiety disorder actually. It's an anxiety disorder in which it's an anxiety disorder in which people have repeated unwanted thoughts. People have repeated unwanted thoughts or ideas or sensations, we can say. And these sensations, unwanted thoughts or ideas, drives them towards something repeatedly, that is towards compulsions. Okay, that these obsessions drive him towards what? Towards compulsions to behave repeatedly, to act repeatedly, okay, to do some action repeatedly. Okay, thus this obsession and compulsion in turn interferes with the daily activities and causes significant distress in a person. Okay, so how can we describe this distress in a person? Like a person has a job and he goes there in the office, he has a lot of work to do, he has a lot of things to check on, and what he does, he feels that his hands are contaminated. If he feels this, that he urges for the compulsions, now he has to go and wash the hands. When he will wash these hands repeatedly for 20 times, repeatedly for 15 times, 20 times, so this will waste a lot of time. This will waste a lot of time. Thus, he is not able to do that work that he is supposed to complete. Okay, that he is supposed to complete. Okay, this will cause distress in that person. Okay, thus it is the definition of this obsessive compulsive disorder.